Hello, everyone. Welcome to today's webinar. All right, we will get started. So as a reminder, this presentation is being recorded and will be shared with you after the call. We will also have time for a Q&A after the call. I will resend instructions of how to submit a question. Sorry, I'm so winded. I just ran up the stairs. And seeing everybody's names and organizations come through. As a reminder, the calls have been shifted to monthly. So we are meeting on the third Wednesday of every month, and our next meeting is September 17th. And then our disclaimer, so the Tennessee Justice Center is a nonprofit tax-exempt organization that is nonpartisan and non-political. The clients we serve and the partners with whom we work represent the state's diversity of political affiliation. Our political analyses relate solely to the defense of health and nutrition programs and do not imply endorsement or disapproval of any party or person. So without further ado, also the context of where we are now. So on July 4th, the One Big Beautiful Bill Act was signed into law. And today we are going to do a quick recap of the bill's impact on the major health and nutrition programs. And we will specifically be focusing on two major challenges that require immediate action, both of which are related to the congressional calendar. So number one, preventing the loss of health coverage for millions of Americans, including nearly 200,000 Tennesseans facing the expiration of premium tax cuts in January. And then the second part of this presentation will be focused on reversing the harmful effects of the new law by capturing the narrative around the bill and its true impact. And we'll cover talking points that we believe will resonate with our fellow Tennesseans across party lines. So I will go ahead and turn it over to Gordon.
Thank you, Reed, and my apologies to everyone. I was, not surprisingly to those who know me, the cause of the technical problems that delayed our getting started. Next slide, please, Reed. We just want to give you the big picture, and then we're going to turn to sort of next steps, as Reed was saying. Just as a reminder, the One Big Beautiful Bill Act, or HR 1, is also technically referred to, encompasses the president's domestic agenda and contains large increases for funding for defense and immigration enforcement, and extended and expanded some enormous tax cuts. So that's the big picture. We're focusing on health and nutrition, and the health and nutrition programs that you're familiar with, Medicaid and SNAP primarily, were cut, and the savings from those were used to pay for the larger bill. The health picture is pretty grim. It cuts the One Big Beautiful Bill Act, or OBA, cuts an estimated $1 trillion from federal health spending over the next decade. That's trillion with a T. And because it's a matching program and states have to put up matching money, the loss of those dollars will also trigger corresponding reductions in state funding. So there are estimates that the total impact will be $1.3 trillion. The Congressional Budget Office, and by the way, when we give these numbers, sometimes there are inconsistencies in what you see because there have been revised estimates. Different organizations make different assumptions. When you're projecting out into the future, you have to make a lot of assumptions, and different organizations and analysts make different assumptions. But the important thing to understand is the order of magnitude. We're talking huge numbers, both in terms of dollars of impact and also the numbers of people. So in the total scheme of things, some of the discrepancies between different estimates are not as important as just understanding that these are, in fact, quite large and quite devastating. In the case of the Affordable Care Act, also known as Obamacare, there are a lot of technical changes that instead of trying to just repeal it wholesale, as was attempted in the first Trump administration unsuccessfully, now the attempt is to undo it by just making many technical cuts that make the coverage more expensive and less useful. Next slide, please. We want to just clarify that the way the bill finally passed has quite different treatments of different states. And the bill discriminates heavily against Democratic states, which benefits Tennessee as a state which is run by the Republican Party. It also discriminates very heavily and inflicts serious cuts on the 40 states that expanded Medicaid. And unfortunately, we have never expanded Medicaid. That has cost 300,000 Tennesseans a year in working families their coverage that could have been benefiting over the past 10 years. Sadly, they haven't, and we know that the consequences of that are quite dire in terms of both financial impact on households and also on their health. But at this particular moment, because of the animus, the Republican animus against the Affordable Care Act and their desire to punish the states that expanded, we actually were exempted. We and the other 10 other 9 non-expansion states have been exempted for some of the worst of those cuts. So don't worry, we're gonna suffer. There's no question about that. But we just want to point out that when you read the national media, some of what's being talked about, which are Medicaid work requirements and shifts in financing that involve taxes on healthcare providers, do not apply to Tennessee. And in earlier webinars over the course of the spring and summer, when the bill was moving towards passage and we were dealing with drafts, we put out information about the projected impact then that included Medicaid work requirements and provider tax changes. But in the final analysis, those do not apply to Tennessee. Next slide, please. But as I mentioned, we are still going to suffer as a result of the passage of the law. KFF, formerly Kaiser Family Foundation, which is respected as sort of the gold standard for neutral analysis of health policy and health spending, has projected that Tennessee will lose an annual average of $900 million. Now, that's against a TennCare program now that is around 13 billion. So that is a lot of money. And so that's quite serious. The preliminary CBO estimates are that 300,000 Tennesseans will gradually lose their coverage from changes to both Medicaid and the Affordable Care Act coverage that's purchased through the marketplace. In addition to that, another 197,000, and we're really going to talk about this in more detail in a few minutes. That's in addition to the 190,000 who will become uninsured in January when enhanced premium tax credits to purchase coverage through the insurance exchange, so-called Obamacare, will expire December 31st if they are not extended. And that will immediately make their coverage unaffordable. Next slide, please. So we get a lot of questions. Understandably, everyone is anxious to know who's going to lose their coverage. And there are losses for certain immigrant groups, but sadly, most immigrants have not been eligible for coverage to begin with. And the numbers, while significant for those affected, are pretty small. The major losses will cut across all categories that people are eligible. And the reason for that is the bill uses increased red tape that just makes it difficult for people to enroll and to hang on to their coverage once they are enrolled, because they have to go through an annual redetermination process. And the bill rolled back protections that made it easier for people on Medicare, the social insurance program for people who are elderly or retired that provides health benefits for them as distinct from Medicaid. there's something called a Medicare Savings Program in which Medicaid, or in Tennessee, TennCare, subsidizes the purchase of Medicare premiums, payment of their premiums, and underwrite some of the cost sharing. And so without this Medicare Savings Program, Medicare coverage is much less effective and robust, and it is more costly for seniors and people with disabilities. So the bill makes it more difficult for people to qualify for the Medicare Savings Program. It reinstates enrollment barriers for young children, and it will increase churn. That's the technical term for, as the name implies, just constant turnover. People enroll with great difficulty. It becomes, the paperwork makes it difficult for them to maintain their coverage. They fall off, they re-enroll, and that just creates enormous administrative burden on states as well as enrollees. But because the ways in which people will lose coverage have to do with their individual ability to navigate a complex system of red tape, it's random as to who loses coverage, and it means that people lose coverage across all categories. And so that's really important to emphasize, because part of the talking points of those who defend the bill is that, well, it doesn't affect children, for example, or it doesn't affect other groups. No, it affects everybody who has to enroll in this process and go through the re-enrollment each year, which is basically everybody. Next slide, please. So just to recap quickly, and we're going to move on to nutrition. The impacts of the One Big Beautiful Bill Act in Tennessee are $900 million a year in reduced funding for health services that ripples across the healthcare infrastructure. And that comes about as a result of people losing benefits, which means that their coverage is not reimbursed, and that affects healthcare providers. And that's a result of red tape. It means that qualified immigrants, such as people who in Afghanistan or Iraq translated for the American embassy or for American military and who were granted asylum here, they're losing their health coverage, those and other lawfully present immigrants. The loss of funding, that $900 million each year, will ripple across, and it will be most have the greatest impact in rural communities, because rural healthcare providers are especially dependent upon Medicaid funding. And you will hear a great deal about a $50 billion fund that was created called the Rural Transformation Fund. And that was as a talking point to defend the One Big Beautiful Bill Act, because there's a great deal of attention to the impact on rural health. Just the quick critique of that is that it's that the large numbers of dollars that you hear about there are spread over 50 states, over 5 years. It's not clear who's going to get it. And the main thing is the math doesn't work. If you look at that fund, it sounds like a lot of money, but then when you realize how it's going to be parceled out over years and among 50 states, and you put that up against the $1.3 trillion that's coming out of the program over 10 years, it just doesn't, you're knocking a hole in the bottom of the boat and then trying to use a thimble to bail it out. The two other big impacts, and we're going to talk about this more after Jane describes the SNAP coverage, is the loss in ACA coverage. This is as a result of the enhanced premium tax credits expiring, and the impact of the One Big Beautiful Bill on nursing home safety. We're going to talk about those because we think those are really salient topics for the work that is to be done right now. So with that, I'm going to turn it back to Reed.
Thank you, Gordon. And we will go ahead and move forward with Jane, who will be speaking about the Supplemental Nutrition Assistance Program. So go ahead, Jane.
Thanks, y'all. So as you all know, Signe, who is our Senior Director of Nutrition Advocacy, has been talking about painting a picture of the damage to the SNAP program coming from this, the federal bill. And we're not going to rehash all those specifics. We have some resources that Reed will share with you all later about getting really granular about the impacts on both the SNAP and Medicaid sides. But just to quickly bring us all up to speed, the most immediate impacts of the federal bill on the SNAP program is imposing work reporting requirements to more groups. So where folks experiencing homelessness, veterans, and some seniors were exempt from work requirements, moving forward, they will no longer be. And then again, just similar to what Goran just laid out, there will be a restriction on which immigrants qualify for the SNAP program, and it's going to make it harder for certain folks who have been granted asylum or have entered the United States as refugees to use SNAP while they're kind of establishing themselves. So those are the two things that we are watching and are, planning to build our advocacy around, and we recommend you all do the same. What we recommend for folks is if you are in a position to advise individuals as to participating in SNAP, of course, there are changes coming, but if you're eligible, please continue to apply under the current rules. What we're waiting for is for USDA, which is the agency in charge of SNAP. We're waiting for USDA to implement regulations that will actually tell Tennessee and other states how to change their SNAP program. Just because certain changes have been implemented or certain changes are present at the federal level in the federal bill doesn't mean states have immediately taken action yet. So please continue to advise folks to apply under current rules, and we'll wait for USDA before we start, saying that folks are no longer eligible for SNAP. And to that point, we're just preparing for implementation, waiting for USDA guidance as to how staff will be trained, because we know that the SNAP agency here in Tennessee is Department of Human Services, DHS, will need its workers to look at the program differently and evaluate materials differently. So staff training is a huge, huge barrier that's coming up. And as always, we'll share information as soon as we have it. So I'll just take another minute to share with you all some federal updates on the SNAP program. You might be hearing a little bit about a farm bill that will be introduced in the next weeks. A farm bill is an agricultural and food spending legislation that, again, just affects the overall food system. This is completely separate from all the SNAP provisions that have been in this bill that in the HR 1 that I just talked about. So you'll hear a little bit about a farm bill being introduced, suggesting that there could be improvements to SNAP in the package, but there's no funding for these changes. After the implementation of the Big Beautiful Bill, there are already significant questions about how the SNAP program will be administered at the federal and state levels. So this farm bill is just essentially what I'll talk about in a second is just for optics. There's a much larger concern around the cuts that are coming from the from HR 1. So any changes that are proposed in a farm bill will do really nothing to minimize the harms that we're anticipating will come from HR 1. So you'll hear a lot about the farm bill, but we're next slide, please. But we encourage you all to really focus your attention on the quote unquote big beautiful bill and continue to push for those provisions to be repealed. If anything, we want the current farm bill to be extended another year because it has provisions that protects partly the SNAP program and also farmers and other folks who rely on the food system generally. So there's a lot of attention that it might be thrown to that, but we want to keep your focus on the BBB. So once again, we're urging our representatives not to consider the farm bill unless and until there are steps taken to fix some of the damage of HR 1. Next, please. Lastly, I just wanted to mention to folks who I know we have a lot of advocates on here who work with folks who are applying for SNAP. And so this is just a tip for you all. There is going to be a major reorganization of the USDA. Again, that's the agency that's implementing SNAP. They're going to be moving positions out of DC to 5 regional offices and reducing the number of regional offices. So it's going to be harder for folks who have used these regional offices to raise up problems that they're seeing with the SNAP program and have kind of tailored solutions. It might be harder for the SNAP program to run effectively because there are going to be fewer experts that can respond. So we already know that some folks in Congress are pushing back, but that is another concern we have about the SNAP program and its administration in the near future is if it's harder to identify a source that can help when there are SNAP issues, it can really affect our ability to work with individual clients. And we'll share out the full memo for folks again who are working at an organizational level with folks on SNAP so that you're more prepared for those changes as they happen. Next slide. And that concludes it for SNAP. I'm going to go right into the more of the areas for advocacy that Gordon alluded to in his presentation. So we're just going to be looking ahead to those two areas that I've referred to as our battleground right now, because there is opportunity for improvement, opportunity for change, and hopefully with this information, you all are in a position to take action. So I'll be covering the enhanced premium tax credits first, and then I'll throw it back to Gordon to cover some of that narrative around the bill. Next slide, please. So the background to all of this is funding. It always comes back to funding. Right now, Congress is in recess until after Labor Day. So the month of August, as we shared in our prior briefing last month, has really been a time for individuals and for organizations to push for FaceTime with their representatives who are back in Tennessee, so they can we as advocates can be upfront about the challenges and the negative effects of these bills. We have several congressmen and senators who are campaigning in defense of the bill, who are parroting the same talking points about how this bill is good for Tennesseans, is good for the country. We hope that we've done our job to inform you all about how that's not true, at least when it comes to the public benefit space, and that there are significant harms that are coming in the near future. So this month has really been a time to push for those meetings, those conversations, and again, just speaking more clearly and about the harms of the bill. So what pressures on Congress? Well, the current federal budget year ends on September 30th. That's less than a month after Congress returns from its recess, but there has not been a budget proposal submitted in advance of that fiscal year. So there's been a huge question mark about the next the next fiscal year's budget. But to fund the federal government and prevent a government shutdown, Congress needs to pass a continuing resolution. This is not like the budget resolution that we just talked about, because that required a simple majority, and we saw that it passed by one vote, and it was it was a very difficult fight to get that bill passed by simple majority. Now, with the continuing resolution, that requires 60 votes in the Senate, and Republicans hold only 53 Senate seats. So they need to collaborate with Democratic representatives to pass the continuing resolution. That's why you'll hear a little bit about bipartisan negotiations right now, and that sets the stage for what I'm about to talk about. So recess was this month of August, and then the month of September is the last month of the current fiscal year, and we need a new budget starting October 1st to prevent a government shutdown. So the next couple months, again, we've been saying this all year, but the next couple months continue to be crucial to establishing what's at stake for these programs and others. Next slide, please. So when we talk about opportunities for bipartisan negotiations, one thing that we're talking about is the enhanced premium tax credit. So to give a little bit of background, the Affordable Care Act, which some people refer to, the Affordable Care Act created the marketplace, which some people refer to as Obamacare. This is insurance that folks who, for example, don't qualify for Medicaid, but don't necessarily have quality or any health insurance through their, like, for example, full-time job. They're kind of caught in this in between, and they rely on the marketplace to get health coverage. Tennessee has an expanded Medicaid, so there are less people that qualify for the Medicaid program, which means there are more people that rely on the marketplace. It offers coverage that's pretty affordable to folks who tend to be low wage and employed. So they're already working, they're trying to make ends meet, and this is their path to health coverage. Currently, there are 628,000 Tennesseans enrolled through the marketplace. That's almost a million people who are relying on the ACA marketplace for their health insurance. And the vast majority of enrollees in this marketplace receive a tax credit that makes their monthly premiums much more affordable. So some folks are getting a premium tax credit. A lot of folks are getting a premium tax credit. And then some folks are getting the enhanced premium tax credit, which was a structure that um, the previous administration developed during the pandemic to keep health prices low. So enhanced premium tax credits are what's in danger right now. That's what we're going to be talking about. And I can't stress this enough. These credits are a lifeline for many families, and enrollment in the marketplace is only affordable because they're able to get these tax credits. Next slide, please. So the battleground. This bill, HR 1, has been touted as a way to keep costs low for Americans. And one of the ways it did that is by reducing taxes. But one way that the bill failed to address potential expensive taxes that individuals are facing is through the premium tax credits. So while it cut, it enabled several tax cuts. It didn't extend the premium tax credits. So we've talked about this a little bit before, but the question is who's benefiting from the tax cuts that were extended in that bill? Because if you extend several tax cuts and then stop short of the marketplace, the premium tax credits, there are a large number of individuals, millions of individuals across the country that are asking the question, why didn't you help me? So that's the context that this conversation kind of arises, because we are in a position to push for the extension of those premium tax credits. And the narrative is simple. In the mega bill, all these other tax cuts were extended. Why not the premium tax credits? That's where we're at. So as of December 31st, those enhanced premium tax credits that I'm talking about, they're set to expire. So we want to push Congress to extend them, because the alternative is that almost 200,000 Tennesseans will lose coverage because they can't pay the premiums. The number of uninsured people will rise, and we've seen estimates that some people's premiums will rise as much as 30%. So if you're paying, if you could be seeing an increase of hundreds of dollars, and we don't want that for Tennesseans. We don't want that for folks across the country. So we're pushing for these tax credits to be extended, these tax credits to be extended just the same way as others were. Next slide, please. So to prevent marketplace coverage becoming unaffordable, we have a clear ask, as I just explained. So we want to make this a fight, we want to make this a focus, and we know that we can win. As we noted earlier, this recess period is coming to an end after Labor Day. So we have multiple folks in Congress who have to pass a continuing resolution, and they have to collaborate with folks across either aisle. So this is a really good time to say, if there was ever an area for bipartisan collaboration and negotiation, it is the tax credits. So if we create enough pressure during and after the recess, we can get this win. And so we just want to push for that. And just want to reiterate, if you have ACA coverage, please share your story with us as part of this effort. And once again, we're just trying to reinforce the idea that the bill, which is set to reduce costs for Americans, stopped short of reducing a major one with the premium tax credit. So we're going to just hone in on that. And that's all I have. Next week, actually on Monday at the TJC office, we will have a panel talking about this very issue. What you need to know. We'll have folks from the business community talking about why this is so important. Extending the premium tax credits is so important. So we have a link which we'll share out to register and get more information. But we'll be hosting an in-person conversation with Gordon and I, Reed, and all the folks at TJC you see on these calls to inform you all. So it's going to be in person at the TJC office, and those details will be shared out to folks after the call. That's all I have, and I'll turn it back over to Gordon.
Thank you, Jane. The other sort of immediate challenge, and I would say opportunity before us, is to really get the story out about the damaging effects of the One Big Beautiful Bill Act. Polling showed that at the time that it was rushed through in the dark of night, literally, to final passage in the House on July 3rd, the polling showed that it was pretty unpopular, majority of Americans. And although, and that included, by the way, traditional Republicans and independents as well as Democrats. MAGA Republicans had a more favorable view, but when they learned about what it did to healthcare, their approval went way down as well. So what we're seeing right now is a very ardent, I would even say vehement campaign by members of Congress who supported the bill, including prominently here in Tennessee, Senator Marsha Blackburn, have been saying that the critique of the One Big Beautiful Bill Act, it's just lies. No one is hurt. It's all to the good. And it's just Democrats telling lies. Again, to reemphasize our initial disclaimer, we are nonpartisan. We don't advocate for either party. But we need to cut through this. Who's lying? Is it the Republicans lying? Is it Democrats lying? And just say, here are the facts of the bill. And this is why it is harmful to Tennesseans, regardless of how they vote or what their party affiliation is. And we want to give you a couple of kind of fresh cuts or fresh takes, talking points on the bill that we think will appeal across lines. Next slide, please. And there is one issue which has gotten little attention. We talked about it a little bit on the last briefing, but really want to elevate it here because it really has appeal, I think, regardless of party affiliation. And that's that and there's really no excuse for it. The One Big Beautiful Bill Act had nothing to do with extending tax cuts or strengthening border enforcement or any of the things that might be popular to people who otherwise support the bill. It did none of those things. It basically gutted important nursing home safety and quality of care standards that were to go into effect that would have greatly improved the safety of the 1.2 million Americans who are living in nursing homes across the country. And just to go into a little bit of background, I've been involved in advocating for nursing home improvements going back into the 1980s. When I first started, it was with the hope of improving care in case my parents needed it. Now, as you can tell from my my image on the screen, I'm looking at the prospect of nursing home care potentially for myself and those in my age group. And throughout those decades, the chronic problem has been lack of staffing. If you look at who is in nursing homes, it's people who need lots of care just getting through the basic functions of living day to day. And that takes a lot of staff, and that cuts into the profitability of nursing homes. Nursing homes are overwhelmingly a for-profit industry. Increasingly, they're owned by private investors and hedge funds with a hyper focus on profitability, and that cuts against staffing up as they should be. So in the wake of the COVID pandemic, and you'll recall that the hotspots for COVID mortality were nursing homes, both residents and staff. Staffing plummeted. People left at jobs that were already difficult. It takes hard work, both physically and emotionally, to work in a nursing home, and the pay is not great. It requires people with special commitment to do that work well. And the number of caregivers available to care for staff is already problematic and it's fallen off. And what are the consequences of that? It means, and there's a lot of medical research on this, that implicates the lack of staffing as a major contributor to the fact that dehydration, which leads to hospitalization and death in many cases, is happening across the country. Dehydration has been with us in nursing homes as a common problem. And just has to do with there's nobody there to provide water and to help someone who can't drink for themselves without someone holding the cup, assisting them, prompting them to drink. That's, they're not staffed to do that. Similarly, malnutrition is widespread in nursing homes, and that's because it can take a lot of staff to help someone who can't feed themselves eat, and that's time consuming. If you don't have the staff, it doesn't happen. Bed sores. Everyone has heard horror stories about the prevalence of skin breakdown and bed sores or decubitus ulcers in nursing home residents. And that's because of poor hygiene, the lack of staff to provide hygiene, to clean up. Keep in mind, over half of nursing home residents are incontinent. And there are all these horror stories of people lying in their own waste for hours on end with skin breakdown that leads to infections and and deaths. And there's been an estimate that with the repeal or the blocking of these nursing standards, staffing standards, that will translate into 13,000 increased deaths each year among nursing home residents. So what happened was that the nursing home industry, which spent huge amounts of money to lobby, succeeded. And the One Big Beautiful Bill Act included this enormous gift that said, you don't have to comply with these standards, and we're going to make it even better for you, nursing home industry contributors. We are going to make it unlawful for the federal government to pass similar regulations for the next decade. You've got to get out of jail free pass for 10 years on this. The standards were very modest. They required, for example, that nursing home have to have a single registered nurse on premises 24/7. I think most of us coming to this would think, you mean they don't already? Well, the answer is most do not. And they don't have the other staff on board to provide the non-skilled nursing services like feeding people, turning them, cleaning up their wastes, and so forth. And so fewer than 1 in 5 meet those modest standards right now. That's where we are. I think we need to get the word out because most people will be horrified at that. Next slide, please. And then there's one more piece that we think will have invoke universal concern, and that's the impact on our children's futures. The Congressional Budget Office, the nonpartisan scorekeeper that puts out the financial estimates, reports that the One Big Beautiful Bill Act will add $3.4 trillion to the debt. And this is without a war or recession or some other crisis that justifies adding that kind of money to the deficit. And it increases the worries across partisan lines about our economic policy and how that will ultimately affect our credit worthiness. And as the slide refers to diddling the estimates, that's an accurate description because what the Senate did as it was having difficulty passing the bill, and this estimate of 3.4 trillion came out, and budget hawks were criticizing it, they went back to the staff and said, you need to refigure these numbers, and they reduced it down to something like $400 million. Well, that may work in the political world, but not in the real marketplace. It's going to this kind of deficit spending is going to make borrowing more costly. It's going to make bond markets unstable. It's going to make national and international investors wary about investing in our bonds, which is how we finance our debt. It could hasten the day in which dollars are no longer the world's reserve currency, which will greatly affect our economy, and it could stifle future economic development with long-term consequences for future generations. So this should be a concern to everyone. Obviously, when we talk about, for example, extending the enhanced premium tax credits, that has fiscal consequences. They are small in comparison. They are real, but they are small in comparison to what the damage is done to through the One Big Beautiful Bill Act, and they are investments in working families and enabling them to maintain their financial security. So those are our talking points. Those are our challenges. I'm going to give it back to Reed.
Thank you, Gordon, and thank you, Jane, so much. I mean, this presentation leaves me speechless each week, and this is our day-to-day working here, and I think it also just highlights though how critical the work that TJC is doing and so many other organizations. It shouldn't take a team of attorneys to get people healthcare, but that is where we're at right now. So thank you all too for being with us and being a part of this fight with us. I put the links to the fact sheets here in the chat for you to review after the call. We'll also include that in the email as well. But just thinking about the nursing home impacts, I think anybody on this call with grandparents or people who are in nursing homes, I'm at a loss of words right now. So, but I guess the big takeaways to focus on now is to be spreading the word about the need to extend the enhanced premium tax credits. We really hope that if you're able to, or if you're in the Nashville area, that you're able to join us on August 25th. If you're registered for these calls, you'll receive communication and details about this event. I'm pretty sure we're gonna send that out either today or tomorrow. So just be monitoring that. But the location, date, time is set. And then also to let your member of Congress and Senators Blackburn and Haggerty know that you disapprove of the cuts and ask them to help families meet their basic needs. So I'll put the link to find their contact information there on recess right now. So they should hopefully be available to meet with people who reach out to them. We also ask that you also push back against any misinformation that you come across on social media. Write letters to to your news editors. You can write op-ed pieces. We've had people on the calls on these calls that join us send us their letters that they write, and just I think sharing it digitally, that's the age that we're in. So if you choose to do that, tag TJC, follow TJC on social media if you aren't already. I just dropped the link in the chat to how you can follow us. You just click on the pictures and it takes you directly to our social media handles. And then last but surely not least, we encourage you to share your story with us. Or if you are in this line of work and you have clients that are have struggled with getting Medicaid or nutrition benefits, to encourage them to share their story with us. So we offer 3 ways to do that, and I just put information in that as well. So we will go ahead and open up the floor for Q&A. We already have some questions, so I will just be managing that and designating the questions to Gordon or Jane respectively. I'm just keeping an eye on time too. So the first question that I think we should discuss is a question about restoring enhanced premium tax credits. So the question is there hope for passing HR 247? It's the Healthcare Affordability Act to restore and make the enhanced premium tax credits permanent, or have you heard whether any other legislation will be introduced? And I guess that's for either one of you.
I think I can take that on, and I have to say, I don't know what HR 247 is specifically, but I think if it is legislation that would proceed in the normal course of things, I think the answer is that's not likely because it would require 60 vote majority in the Senate. The reason why we talked about the continuing resolution is that also requires a 60 vote majority, but it is to extend funding for the federal government. It has to pass to avoid a government shutdown. It will pass. And because it requires 60 votes, and the Republicans can't muster 60 votes on their own, it affords an opportunity for moderate Republicans and for Democrats to bargain to include extension of the premium tax credits, enhanced premium tax credits, as part of a deal to pass the continuing resolution, keep the government funded. So that is the vehicle, whether it is done through the continuing resolution or freestanding legislation, it's the same effect. And because passing freestanding legislation would probably be unlikely, that's the reason for the focus on the continuing resolution. And that's the sense of urgency we're trying to convey, because that's a fight that will be fought out between now and early October.
Thank you so much, Jane. Is there anything that you would like to know? Okay. So our next question is from Jeff K. I will do my best to synthesize this, but basically, Jeff and his organization, I presume, did their own score on the Big Beautiful Bill and the impact on TennCare in Tennessee specific data. The analysis indicates that the gross fiscal irresponsibility, or GFI, may have very large impacts on Tennessee. The score was 210,000 TennCare cuts, 100,000 losses on private healthcare, and 200,000 cuts for the Affordable Care Act. And so the question is, with all of those numbers, I can also send this in the chat too for anybody who's also a visual learner. Do you anticipate any losses in public or private insurers leaving rural Tennessee? I know Gordon's touched on the impact that the bill will have on rural Tennessee in general, but this question seems to be asking about public and private insurers leaving rural Tennessee.
I think that that is a risk. What happens when you take away the enhanced premium tax credits and you make the cost of coverage more expensive through the marketplace? The people that are relatively well will make the calculation, look, I can't miss mortgage payments, I can't miss car payments, I can't make other sacrifices to hang on to this insurance. I'm going to give it up and try to go make my way through life without health coverage and just hope for the best. The people who will do whatever it takes to hang on to insurance, even though it becomes unaffordable, are the people who typically have chronic illnesses where they say, I cannot go without health coverage. And if that means missing mortgage payments or losing the car or whatever else, literally not eating, I'm going to hang on to it. In the insurance industry, that's called adverse selection. What that means is that instead of insurance working where millions of people pay in and most of them don't need hospital benefits during the year, and the few that do and are very expensive, their coverage is paid for, their expenses are paid because everybody's putting into the pot with the assurance that if I do need a really expensive service, it'll be paid for. Well, if what you do is you take that pool of people who are paying in and the healthy ones go away and you get a sicker and sicker group of people, it becomes, the premiums go up, it becomes more unaffordable. You create a death spiral. And at some point, insurers say, we don't want to insure in that market anymore. So I think that's what that question goes to. When you pull out the healthier people, because you make it unaffordable and you make their calculations such that they're not going to stay insured anymore, that means that the pool that's left is sicker, and it doesn't work for insurance companies to be selling to that population if the cost is not going to be diluted by collecting premiums from a lot of healthy people as well. So there's concern that this will have ripple effects. It's just like when you take funding out of Medicaid, that has ripple effects for people who are not on the program because the rural hospitals are less viable or their nursing homes are not going to be staffed. So it has a knock-on effect that affects all of us, whether we're covered or not by a particular program.
Thank you, Gordon. I want to be mindful of time and that we do have some other action items to get through, but we did have a question that asking if we can share exact verbiage of what to tell senators and elected officials. We did send talking points, but maybe a script. So I'm saying that out loud so that our team, after this call, can huddle and get that included in the follow-up email after this. If we uh, there are other questions that I'm seeing come through. I don't think we'll have time to get through those today, so we will follow up accordingly via email because the next time we meet is not going to be till September. So we'll address your questions via email. I will our call to action. Number one, register to vote. This is also the link to check your voter registration if you've recently moved, if you've changed your name for getting married, or any other reason why your voter registration may change. You can take care of that all at this link. Follow TJC on social media and also stay informed. We are sharing verified information. We are fact checking in the wee hours. Our team is constantly online doing some deep digging into the research for you all. So we typically email this information out. If you're on this call, you're obviously already signed up for our emails, but we encourage you to forward our emails to 5 friends and to do that today so that you're all maybe you all get coffee together and join us for our next call in September. The next thing, contact Congress. I shared the information earlier in the chat of how to find their contact information. Again, this will all be in the follow-up email. But go to town halls, local fairs, other venues where members of Congress may be, as well as creating your own gatherings. Like I said, getting coffee with 5 friends and doing it together. So it works in numbers. So share your story with TJC. And we also have some upcoming events coming up. So on August 28th, we have our 2025 release of the data dashboard. This is at 1:30 p.m. Central Time, facilitated by our very own Jane Dimwobi and our other health policy interns who are now at their respective colleges, but will be joining in for this call. So we definitely encourage you to join us for that. We also have the premium tax credits panel on August 25th. That is in person. So the data dashboard, if I didn't already say that, is virtual. The tax credits, this is in person at TJC on Monday at 4 p.m. We'll be sharing more information about that. And then we will see you all next month on September 17th. And we will follow up with any questions via email, but we'll stick around too for anybody. But thank you so much for joining us, and we appreciate your time.
Reed, can we make a final plug? The Tennessee Healthcare Campaign put this in the chat, but they'll have their annual conference, for annual symposium from September 18th, I believe, onward. And let me get the exact date. And we hope that you all will join the healthcare campaign, September 18th to 19th in Chattanooga. These folks are our close partners. Everything that we share on this call, they've been a part of the fight with us. So if you all are able to please join, please attend. TJC will be presenting separately both on the impacts of the bill on Medicaid as well as the impact on the SNAP program. So you've heard a lot from us here, but this is a bit of a different setting, and you'll learn more about the bill's impacts in the context of some other crucial work around health equity in the state of Tennessee. So we can pub that in our email as well, but just wanted to let you all know that our close partners at the healthcare campaign are putting together some really great stuff to push the conversation forward.
Thank you all so much. I think that's it. So hope you have a great rest of your Wednesday. Thanks.